Hello, I'm Dr. Christine Crawford, and I'm the Associate Medical Director for the National Alliance on Mental Illness, also known as NAMI. I welcome our panel of experts and our virtual audience to today's discussion about youth mental health suicide, the effects of the pandemic, and prevention. As a child psychiatrist, I see each and every day in clinic the tremendous toll and impact that this pandemic has had on the emotional well-being of the youth in this country. And I'm really looking forward to this discussion today so that we can learn about ways in which we can save lives, save the lives of children, because unfortunately, too many children are dying by suicide, and we need to figure out solutions and offer up help and hope to our youth and the families who take care of them. Allow me to introduce our panel. First up, we have Dr. Don Mordecai, who's the national leader for mental health and wellness at Kaiser Permanente. We also have Mr. Brandon Staglin, who's the president of One Mind. We also have Dr. Monica Taylor-Desir, American Psychiatric Association Foundation board member. And lastly, we have Dr. Janis Whitlock, who's the senior advisor for the JED Foundation. Thank you again for being with us. So let's begin, let's dive into this discussion. So the first question that I have, I'm going to direct this question to Dr. Whitlock. What kind of supports do the nation's youth need in order to achieve emotional wellness? What needs to change in the system in order to make that possible?
Thank you, Dr. Crawford, and welcome to everybody. I think primarily young people need adults who care and who are tuned into their needs. They also need systems that are responsive and capable of providing really needed support. We need enough available mental health support at low or no cost to be sure that everybody who needs it gets it. And it needs to not just be for young people, because young people sit in larger family systems and are extraordinarily sensitive to the well-being and mental health status of the people in their systems. So if we're serious about taking care of young people, we really need to be taking care of all of this, the people that support them. And then lastly, I think emotional wellness isn't just about mental health treatment. It's about lifelong learning in areas of emotion and the relationship between emotion, thoughts, and behaviors. Young people need clear role models, validation for the fact that they're emotional beings, and they need support in learning how to work with emotions, especially when they feel overwhelming.
And I really appreciate when you talk about the systems, the families that these children come from, and how the entire family system needs to be well in order for the child to be well. So we also have to prioritize the emotional well-being of everyone. So I really appreciate you highlighting that. I wonder, do other members of the panel have anything to add?
Yes, thank you for opening it up. The well-being of young people depends not only on mental health care and emotional health care, but also on everyday life. So prevention is an important aspect of maintaining the mental health and well-being and emotional well-being of young people. Things that we can do to enhance young people's mental well-being could revolve around schools in a large degree, because that's where young people spend a lot of their time. And especially now that they're going back to school when the pandemic is winding down, fingers crossed. But the programs in schools, I think they should be enhanced around things not only for mental health and emotional learning and education, but also around activities that bring young people together. A study found that young people who were active in school and had active social relationships and a network within their school had less anxiety and depression than young people who were more isolated. And I think building on that, we could talk about instituting programs for young people to do things together. So clubs, for example, on topics even unrelated to mental health. Activities like arts education, which are unfortunately being degraded or the funding is being reduced in so many schools, especially in disadvantaged communities. These are activities that young people can get involved in together and learn from each other through and build meaningful relationships by doing these things that can support their mental health and well-being.
Absolutely. And talking about schools and really making sure that schools have the tools and resources necessary in order to support our youth. Dr. Taylor-Desir, what are your thoughts?
Thank you. Definitely, I identify areas of support for our young people as just looking at the 4 areas of social support. So looking at informational support, and instrumental support, emotional support, and appraisal support. So I had the opportunity to really work with tribal communities and bringing in families who had adolescents that had attempted suicide. And we really looked at doing some psychoeducation with the entire family. So when we say the family, it's not just mom, dad, and I would say whoever is in the house and whoever supports your mental health. So sometimes we had extended families, sometimes we had friends or teachers. We'd even included probation officers. But when you're looking at what changes do we need in the system, really looking at where are we and youth getting information, and where can they get good, solid information, and making sure that we are going where they're getting that information. So that may not mean a pamphlet or a brochure. It might mean TikTok and Facebook. Who are the adults that are there to support them, and how can we educate the adults? When we're looking at emotional support, do our families and do our adults have specific words for their feelings and knowing good ways to communicate with each other? And then when we talk about appraisal support, just how do we provide feedback to each other, and how do we receive that feedback?
Communication is key, and using the language that resonates with the youth, using the language that resonates with the family, it's so important. And meeting the kids where they're at in terms of where they're getting their information. We need to adapt to the way that our young people are accessing information. So I'm really happy that you touched upon that. I wanted to ask you, Dr. Mordecai, between 2009 and 2019, the percentage of teens who reported persistent feelings of sadness or hopelessness, it rose. It went from 26% to 37%. And in 2021, the figure rose to 44%. So, Dr. Mordecai, what do you think are some of the causes for this increase in teens reporting that they're struggling emotionally?
Well, right. And as you point out, 2019, that was pre-pandemic. And so it's only gotten worse. The causes are very likely to be multifactorial. I think we're seeing in an odd way at a time when kids and young people are much more connected in some ways by the digital sphere, they're also disconnected. They're spending less time actually with each other in social situations and more time with each other, but not together. So I have a lot of concern about that. I think there is a general failing in our society to actually have appropriate resources to meet the need. And so as demand goes up and yet the supply is not keeping pace, then access gets worse and worse. I mean, we live in a country, and I'm sure you know this, as do many of our panelists, where less than half of people with a mental health condition get any treatment at all, right? And way less than half get evidence-based treatment. And it's worse for communities of color, and it's worse for young people, and it's way worse for people with substance use disorders. And so there is a general failing in our society to really grapple with the needs of the population, both the young population, and I really appreciate how the other panelists talked about the adults. What are we doing for the teachers? What are we doing for the parents? The Kaiser Permanente did a study called the Adverse Childhood Experiences Study back in 1999, and it demonstrated that what happens to a child in the home in their early life has profound consequences for their physical and mental health downstream. And so I think we really need to be paying attention both to the care system, but also to these upstream factors like social isolation, lack of support, lack of treatment resources.
And just to follow up on that, Dr. Mordecai, I'm so curious to hear your thoughts about what may be contributing to this sense of disconnectedness, feeling detached, the isolation that our youth are experiencing. What are your thoughts about what might be driving some of that?
Yeah, I think, well, first of all, the pandemic, you look at that as a microcosm accelerant of disconnection, right? So kids not being able to go to school, not being able to gather, not being able to do sports or clubs like Brandon was talking about. So that's a very acute sort of piece of that. I think we've become a society that is less about being together and more about doing things individually. And again, I come back to what the effect of media, right? That we all feel like we're together and yet are together much less. I mean, I have two sons, and I watched their experience of high school. And of course, it was very much colored by the pandemic. But even before the pandemic, they spent more time at home than certainly I did in my generation. And I'm not exactly sure what drives that. I mean, I think our country did go through a period where we became much more fearful for our children. And that may have done where we sort of felt like we needed to watch over them much more closely. That may have sort of cut down on their freedom to sort of associate and do things on their own. But I'd be fascinated to hear what other panelists think might be driving this.
I'll jump in. I feel like, young people are responding to real world changes in real time. I'm constantly struck by the fact that we're living through like truly historical moments. I mean, while there are some historical analogs, I feel like the confluence of factors at work in shaping the now and the future are both really novel and extraordinary. When you think about the political landscape, the COVID landscape, the climate change landscape, the global disruption landscape. I think I know of my children, we talk about this a lot. They don't feel like we, the adults, are responding to the real world issues in very functional ways. We have a lot of systems that are trying to respond, but none of us feel like are real prepared to know how to respond. So I feel like they register that, and they feel like we're maybe heading off a cliff in some cases. That's the way they explain it to me.
I think also, as young people are focusing more on technology, it's a different way of learning social interactions. So, I get really concerned. So when we communicate with each other face to face, we're reading body language, we're reading facial cues. If people are not on video and they're just doing emojis, we've descended into that. We're not getting that feedback of how our words are impacting each other, how what we say has impacts down the line. And, when we're talking about isolation, we descended in a time where we were more on video and on technology, but those are also arenas where kids are getting bullied. And so you may have 500 friends, but who's that one real one that you can lean on? So it's not clicking, it's not meshing together.
Yeah, I see that too, in the fact that there's a real rise of rudeness in our society. I'm sad to say this, but violence and antisocial conduct by prominent figures in our society, unfortunately. And this translates into similar behaviors in people around us who are close to us in our lives. And I think that young people see this and feel dissuaded from reaching out, from being vulnerable, from being open about what they're really experiencing, because they're worried that they will be ridiculed. It's so there are stories about middle school young people are just so they tease each other. I experienced this in middle school myself, but I think it's worse now. They tease each other, they bully each other, and so those are major factors as well for young people who want to kind of hole up, I think, and be it by themselves.
And it's so important for the adults in the children's lives to realize that all of these things that you all have mentioned are serious stressors for our youth. And these are some of the stressors that may have an impact on their mood and how they're feeling, and being aware of the significant impact of bullying, of social media, of being on your phones. It's really important for us adults to take that all into consideration, to know that kind of the social landscape right now for our youth and how it is they navigate the world certainly is different and can have an impact on how they're feeling and how they're thinking. And so, Dr. Taylor-Desir, as we begin to emerge from a pandemic, and the reality is we're still in a pandemic, but things have evolved over time. Do you view prevention differently? Mental health prevention, do you view that differently now than you did 2 years ago?
I haven't really changed my view of prevention. So when I talked about doing that family psychoeducation program, really we looked at doing some primary or thinking universal prevention, because we were talking about diagnoses within a family context. And there were some young people that had never been to see a doctor. So we want to make talking about mental health universal, and that needs to continue, or it needs to increase. So I still think that is important, but I still think, there's importance for secondary intervention and targeted or individual evidence-based intervention once people have a mental health crisis or diagnosis, so they can get those specific therapies. So for myself, it hasn't changed. It just needs to increase in our primary prevention.
I'm very much with you on that, Dr. Taylor-Desir. So I've been a vocal proponent of secondary prevention for serious mental illness, where a young person who is at risk for or exhibiting the early signs of psychosis, which is a symptom of the most serious mental illnesses, including schizophrenia, major depressive disorder, and bipolar disorder. It's prominent in those conditions. And when a young person starts to develop these early warning signs, you can intervene with a team-based recovery-oriented model that partners with the young person to really give them the best chance of recovery from that point forward. And I put a lot of my attention and advocacy into promoting models of care that do that. But it's becoming clear that to really help young people faster and get the results sooner, to prevent mental illnesses from being so prominent among young people, we need to start even earlier. And not earlier, meaning potentially in schools, potentially in the conversations that young people have, but even earlier than that. We can go back to the very beginning stages of life, where mothers are caring for their infants and learning to bond with them and raise them and form healthy attachments with them. Healthy attachment is really key to the independence and sense of confidence of a young person and their resilience as they grow throughout their lives. And so if you can trace it back to the very beginning and help potentially even at-risk mothers who are in disadvantaged communities with supports to help them learn to and form those healthy bonds and support them as they do that, that could be like a lever to pull, so that down the line, say, as these young people are growing into their teenage years and the young adult years, they'll be armed with the tools they need and the confidence they need, the resilience they need to weather the traumas they will inevitably experience as we go into a more and more dangerous world.
I really hope that we take the opportunity of the pandemic to really recognize what we're talking about today, which is the needs of the young people, and do the things that maybe we've been talking about too long and that we need to start doing. So getting into the schools. We have a program called Resilience in Schools, School Environments through our community health arm that aims to work actually directly with the teachers to help support them to better understand how to work with the students. There are a lot of programs focused on kids that are excellent. We felt like there was an opportunity to really address the teachers, the adults in the schools. I think there's a lot of opportunity to decrease stigma. And one of the things I'm encouraged about with the younger generations is that they do seem more willing to talk about mental health struggles and things like that. But they're also suffering the effects of that, as we talked about at the opening. But to make it okay to talk about these things. We've partnered with an esports company called Cloud9, right? One of the prominent team sponsors, and done something called Presence of Mind, where we've worked with these teams and the kids on the teams are tremendous influencers, and help them understand, how do you talk about mental health? How do you talk about somebody who's struggling? How do you reach out to somebody? And that's been tremendously successful way to reach kids where they are, which is, doing gaming and things like that. And then I do want to say, I think there are opportunities to actually change the care system too. So when somebody gets to the point where they need care, what are we doing around workforce? What are we doing around new ways of delivering care that maybe don't require as much as intensive the resources of the kind of system we have now. So collaborative care, which I'm sure many of the people on the panel know about, very well proven in adolescents, proven in adults, really good outcomes for depression and anxiety, which are some of the most common conditions out there. How do we actually make that part of our care systems throughout the country so that we can really radically increase the availability of care? As Janis, I think you were saying, is there are opportunities to really make care much more accessible. So I hope we can take these things to heart if the pandemic has focused us on this, to actually start doing these things.
I'll just hook on real quickly, because with the JED Foundation, we've been talking a lot about the need for earlier self-awareness skills. I think a lot of this is in response to some of the technology issues that have come up already on this panel, in terms of young people just being emotionally and socially overwhelmed, or finding themselves in situations that were just much more rare when I think most of us were growing up, just by virtue of the fact that you couldn't have 1,000 people in your bedroom at 10 o'clock at night on a phone. So being able to help them navigate big emotions and some of the complicated social landscape that they're encountering earlier and earlier in life, because for example, some of the technology research recently has started to show that there are really sensitive windows. So 11 to 13 for girls, 14 to 15 for boys, in which social media has a really big impact on mental health. So we need to be starting much earlier in helping young people prepare themselves to meet the kinds of experiences and stimuli that they're going to be meeting as they start to enter the adolescent phase.
I think I just want to add, with the APA Foundation, they also work with schools and teachers and doing Notice Talk Act. It might have been, if you've heard it, it might be typical or troubled, but just really helping teachers to recognize what type of mental health symptoms are happening in their students, and how they can talk with them and get them care. Because, we talk about our kids, but they spend a lot of time in school before the pandemic. So our teachers still need to know how to reach out to our kids.
Early intervention, empowering people with the knowledge of what mental health symptoms can look like, and also empowering the youth so that they can learn to be better aware of what it is they're experiencing internally, so that they can also seek out help and treatment earlier on. And I just love the way that you all are talking about this and thinking about this. The other thing that's been quite troublesome about youth mental health is that during the pandemic, emergency room visits by young people experiencing suicidal ideation, it increased pretty significantly. It actually spiked, particularly for young people of color. And according to the American Psychiatric Association, Black clinicians represent only 2% of practicing psychiatrists, and there are only 4% of psychologists who are Black who are actually providing care. And the other important thing to know is that according to a 2021 survey conducted by the Trevor Project, 42% of LGBTQ plus youth and 50% of trans and non-binary young people seriously considered suicide. So these statistics talking about how mental health is impacting these communities, these groups that have been marginalized, and thinking about the workforce and how there is a limited supply of mental health providers of color. And it makes me wonder about all the factors that may be contributing to some of these unsettling statistics. So the biggest question for you all is, how do we address stigma? Because it makes me wonder if stigma about getting mental health treatment, stigma about having a fear about being viewed differently, the fear of discrimination. How do we address all of that when it comes to people accessing care, especially from some of these communities that really need the support now? I know that was a really big question, and I'll start off with you, Mr. Staglin. What are your thoughts?
Thank you. Yeah, stigma has formed for me a major impediment to my well-being. I live with schizophrenia. I was diagnosed when I was 18, 27 years ago. And it's been, especially early on, prevented me from accessing the care that could help me to be well. I felt ashamed that I had this mental health condition initially when I started to develop symptoms, and I wanted to manage it on my own. And I didn't trust the healthcare system to help me. I thought that if I took medication, it would turn me into a zombie. I tried talking to a psychiatrist, and he spoke kind of patronizingly as I viewed it, and we didn't connect at all. I imagine what it's like for young people of color, talking to, say, a white psychiatrist or a white therapist, where the trust issues may be even more prominent. And I think that in order to help young people feel less stigma, there needs to be, and less mistrust of the care system, there needs to be a care system that is culturally competent and with practitioners who they identify with and can feel like they can trust and form a bond with. In many cases, that means people of the same race, people of the same ethnicity, people of similar backgrounds, similar sexual orientations, gender preferences. And this is extraordinarily important. So if we can incentivize more practitioners to enter the workforce from a variety of different diverse races, ethnicities, and other characteristics, that will, I think, help reduce the stigma that young people feel. Also, if we can put the care into the community where people are, as opposed to set off in a clinic, somewhere far away, either through telehealth or through drop-in centers in central parts of the community. For example, in California, we have a program called ALCO, which is just getting off the ground. It's a youth-friendly drop-in center where young people can go to socialize with each other, as well as to get basic care for their physical health, their sexual health, their mental health. And this destigmatizes the practice of seeking and giving care, because you're not going off to some strange place. It's someplace where you would normally go. And this can be a conduit to deeper forms of care if the young person gets even more sick over time. So I think there are many ways to destigmatize care, but those are some that I can think of.
Can I speak to the workforce issue, Christine? I think there are some opportunities that maybe are under-recognized. I mean, we've started a program called the Mental Health Scholars Academy, where we say to our own employees who are not necessarily healthcare providers, are you interested in becoming a mental health care provider? And we will pay, I think it's 3/4 all the way up to 100% of their tuition to get a master's degree in counseling, social work, or even a PhD degree. And we've seen incredible uptake, and particularly by people with really diverse backgrounds. And like 40% have language skills beyond English. Like I think 75% identify as people of color. And so we've been really thrilled to find out that our own employees want to serve this need. And I think there's potential to expand that kind of program to other large healthcare and probably even other corporations who say to their employees, we want you to pursue what your passion is. And yes, you may graduate and leave us, but you're going to go serve this country's needs, the needs of our young people for mental health care. That could be amazing.
Absolutely. And we certainly do need to increase the workforce. We need to diversify the workforce. And since we're talking about youth, thinking about child psychiatrists, there's only 8,300 of us in the entire country. And most of us are located on either the East or West Coast, but there are not that many available in rural communities, in indigenous communities. And so I'm curious, to hear both from Dr. Whitlock and Dr. Taylor-Desir, how do you think we can solve the accessibility issue? Do you think that telepsychiatry and teletherapy can figure into the equation to make it such that these communities, folks who are living in rural areas and indigenous communities, can actually access mental health services?
I think definitely funding is needed for telehealth, but you can't just say, okay, we will pay for telehealth services, like we'll reimburse. It has to be funding that will build the infrastructure, because I've had the honor of working on reservations and in frontier communities, and sometimes we laugh about Wi-Fi not being stable, but if you don't even have the infrastructure for the connectivity, it doesn't help if you're going to reimburse, because I can't connect. So that's where the funding needs to go in order to increase that availability.
Yeah, I totally echo that. And also, if we can incentivize and identify individuals within communities that are underserved who would be willing and interested in pursuing advanced training in areas related to the clinical services this way, I think it's really important to have people on the ground that are accessible, physically present, and you get the benefit of that knowledge within their networks in their community, because it would serve, of course, not just clients, but anybody that they come in contact with through their larger communities. I know that's not an easy thing to do. It's much easier to be able to recruit, incentivize out of existing workforces, but I think we could be doing a much better job of inviting and making it easier for people in historically underserved areas to be providers in that way.
And I think so. Also, National Health Service Corps has really broadened now their scholars and loan repairs for mental health. So now they're focusing on mental health. They're focusing on substance use providers, more therapists. So that's wonderful. But also, when we also think about payment systems in indigenous communities, it would be great to be able to also reimburse like the medicine men, the traditional providers, because health isn't just therapy, and it isn't just psychiatrists writing medication. There are all kinds of elements of cultural strength that has already been there, and tribal providers and community health representatives that also need to be recognized and funded.
So glad you said that. Yeah.
Absolutely. I love all of that. And as we close our discussion today, I'd like to thank our panelists, our amazing panelists. I mean, such amazing insights that you all were able to share with us today. And thanks for sharing your expertise as well. And to our audience, I hope this conversation continues in our workplaces, in our homes, and in our schools, as well as throughout our communities. Our nation's youth need and deserve our support, all of our support. So thank you so much for watching, and thank you once again to our panelists.
Thank you.
You're welcome. Thank you.